A pleasant day to all of us. We are the Group 1 and here are the group presenters. Yours truly, Bakwal Maria Teresa Janao Bakwal, Agdepa Arian Cristal, Saceres Brazil Marie, and Kapinpin Monet. So we are here to present the Activity 6 which has a title of Musculoskeletal. To formally start, I would just like to have a quick overview about the musculoskeletal system. Your musculoskeletal system includes your bones, cartilage, ligaments, tendons, and connective tissues. Your skeleton provides a framework for your muscles and other soft tissues. Together, they support your body weight, maintain your posture, and help you move. A wide range of disorders and conditions can lead to problems in the musculoskeletal system, such as aging, injuries, congenital anomalies, or birth defects, and that can cause pain and limit your movement. But you can keep your musculoskeletal system healthy by focusing on your overall health. Eat a balanced diet, maintain a healthy weight, exercise regularly, and see your provider for checkups. So, what are the parts of the musculoskeletal system? It has 6 parts. So, for the first, the musculoskeletal works to help you stand, sit, walk, run, and move. Adult bodies have 206 bones and more than 600 muscles connected by ligaments, tendons, and soft tissues. The first part, which is the bones of all shapes and sizes support your body, protect organs and tissues, store calcium and fat, and produce blood cells. A bone's hard outside shell surrounds a spongy center. Bones provide structure and form for your body. They work with muscles, tendons, ligaments, and other connective tissues to help you move. The next one is the cartilage. It is a type of connective tissue. Cartilage cushions bones inside your joints, along your spine, and in your ribcage. It is firm, rubbery cartilage protect bones from rubbing against each other. You can also have cartilage in your nose, ears, and pelvis and lungs. The next one is the joints. Bones come together to form joints. Some joints have a large range of motion, such as the ball and socket shoulder joint. Other joints, like the knee, allow the bones to move back and forth but not rotate. The next one is the muscles. Each muscle is made up of thousands of stretchy fibers. Your muscles allow you to move, sit upright, and stay still. Some muscles help you to run, dance, and lift. You use others to write your name, fasten a button, talk, and swallow. Ligaments. It is made up of tough collagen fibers. Ligaments connect bones and help you to stabilize your joints. The last one is the tendons. Tendons connect muscles to the bones. It is made up of fibrous tissue and collagen. Tendons are tough but not very stretchy. And for the first part of the activity, we have the questions for research. What is the membrane that covers the bone? The periosteum. What is the function of the membrane that covers the bone? The periosteum has three functions: supplying blood to your bones, giving them their sense of filling, and growing and repairing your bones. Next, what is another name for the shaft of a long bone? It is the diaphysis. What are the ends of a long bone called? It is the epiphysis. Where is compact bone located? It is located in the long bone. Describe the location and function of cancellous bone. Cancellous bone is found at the ends of long bones as well as in the pelvic bones, ribs, skulls, and the vertebrae in the spinal column. Its function is to store bone marrow, allow the red blood cell, white blood cell, and platelet formation in the bone marrow, allow for flexibility within compact and dense cortical bone, and allow the structural integrity within the cortical bone. What are the bone building cells called and where are they located? First one is the osteogenic cells. These are located at the deep layers of the periosteum and the marrow. Next one is the osteoblast. It is located at the growing portions of the bone, including the periosteum and the endosteum. The next one is the osteocytes. It is located at the entrapped in the matrix. The next one is the osteoclasts. It is located at the bone surfaces and sites of old injured or unneeded bone. What cells in the osseous tissue regulate the exchange of calcium between blood and bone? It is the osteoclasts. What hormones are involved in the exchange of calcium between bone and blood? It is the parathyroid hormone. How does the composition of a child's bone differ from an adult? The osteoid density of a child's bone is less than an adult's. Juvenile bone is more porous than adult bone because the Harvesian canals occupy a much greater part of the bone. This is the principal reason of a child's bone can bend more than an adult's bone. Discuss the different patterns of bone growth in long bones and the bones of the skull. The first one is the intramembranous ossification. It is the process of bone development from fibrous membranes. It is involved in the formation of the flat bones of the skull, the mandible, and the clavicles. Ossification begins as mesenchymal cells from a template of the future bone. The next one is the endochondral ossification. It is the process of the bone formation in which cartilage scaffolds, arranged in zones, are gradually replaced by bone. It occurs at the articular or the epiphyseal and the metaphyseal growth plates and secondary centers of ossification, such as the carpal and the tarsal bones. Classify joints according to the type and the amount of motion they permit. Describe the structure of each. The first one is the fibrous. Bones are connected by fibrous tissue. The next one is the cartilaginous. That is where bones connected by cartilage. The last one is the synovial. Articulating surfaces enclosed within the fluid-filled joint capsule. Describe the following types of joint movement. Letter A, abduction. It is a movement away from the midline. Letter B, adduction. It is a movement toward the midline. Letter C, circumduction. A conical movement of a limb extending from the joint at which the movement is controlled. Letter D, flexion, a movement that decreases the angle between two body parts. Letter E, extension, a movement that increases the angle between two body parts. Letter F, hyperextension, is an excessive joint movement in which the angle formed by the bones of a particular joint and is straightened beyond its normal heightened range of motion. Letter G, internal rotation. It is the movement that brings the anterior surface of the limb toward the midline of the body. Letter H, external rotation. It is the rotation of the limb so that the anterior surface moves away from the midline. The letter I, plantar flexion. It is a movement in which the top of your foot points away from the leg. Letter J, dorsiflexion, is the movement that occurs when your foot and shin approximate closer together. Letter K, supination, the rolling movement of the foot in which the most of the weight of the body is transferred to the outer edge of the foot. Letter L, pronation, is a natural movement of the foot that occurs during foot landing while running or walking. Letter M, inversion, is the movement of the sole towards the median plane. Letter N, the eversion, is the movement of the sole away from the median plane. For the next part would be the labeling. For the right scapula, we have spine, glenoid cavity, and the manubrium. For the thoracic cage, we have the true rib, body, xiphoid process, false rib, and the floating rib. What markings on the scapula identify it as right? The glen cavity must be lateral and the spine must be posterior. Letter B. In what region scapula is located? It is located in the upper thoracic region. Letter C. How do you differentiate between true, false, and the floating ribs? True ribs attach differently to the sternum. The false ribs attach through costal cartilage, while the floating ribs have no attachment to the sternum. For the next photo to be labeled, it will be Miss Agdepa who will be discussing it.
So, good day everyone. I'm going to discuss my assigned part, which is the labeling. So, first is the right clavicle and the humerus. Number one is the sternal end. Sternal end is also known as medial end. It is the rounded end of the clavicle that articulates with the manubrium of the sternum. Number two, the acromial end. The acromial end is a small, flattened, oval surface directed obliquely downward which articulates with the acromion of the scapula. It is also served as an attachment point for two ligaments. The two ligaments is the conoid and trapezoid line. Number three is head. The head of the humerus is the articular surface of the upper extremity, which is an irregular hemisphere. The number four is the greater tubercle. The greater tubercle is the most lateral bony point of the humerus and is palpable at the posterolateral aspect of the shoulder. It is served as an attachment point for the supraspinatus, infraspinatus, and teres minor muscles. Number five is the surgical neck. The surgical neck is found just inferior to the tubercles where the shaft begins. It is also a common site for fractures. Number six is medial epicondyle. Medial epicondyle is a secondary growth center at the elbow. It is the common origin of the forearm, flexor, and pronator muscles. Number seven, olecranon fossa. The olecranon fossa is the fossa at the distal end of the humerus into which the olecranon fits when the arm is in full extension. So here's the questions that we're going to answer. Number one is, in what region humerus is located? So humerus located at the brachial region in the upper arm. Number two is how to determine whether humerus is right or left. So we determine it if the capitulum is on the left side of the bone, it is a left humerus. And if the capitulum is on the right side, it is right humerus. So the second which we are going to label is the left ulna and radius. So number one is the olecranon process. So the olecranon process is the large process of the ulna that projects behind the elbow, form the bony prominence of the elbow, and receives the insertion of the triceps muscles. Number 2 is the trochlear knot. So the trochlear knot is the deep depression in the proximal end of the ulna by which the ulna articulates with the trachea of the humerus at the elbow and also the major facilitator of flexion and extension about the elbow. Number 3 is radical tuberosity. So the radical tuberosity is an oval eminence of the medial side of the radius distal to the neck where the tendon of the biceps brachii muscle insert. Then the number 4 is ulna. The ulna is the bone on the little finger side of the human forearm. The main function of ulna along with the radius is to assist with rotation. So the number 5 is the styloid process. The styloid process is a slender projection of bone such as that from the lower surface of the temporal bone of the skull or those at the lower end of the ulna and radius. So here's the questions that we're going to answer. Number 1 is, where are these two bones located? So radius is located laterally to the ulna, and the ulna is located medially to the radius. Number 2 is, which of these bones is medial? So the ulna is the medial bone of the forearm. So the next to be labeled is the bone of the left wrist and hand. So the number 1 is carpals. Carpals are the 8 small bones that make up the wrist that connect the hand to the forearm. The 8 carpal bones are scaphoid, lunate, trichitrum, trapezoid, trapezium, capitate, hamate, pisiform. The carpals are vital in forming the carpus or wrist joint, which is the key to hand movement. The number 2 is metacarpals. So metacarpals are the long, slender bones which connect your wrist to your fingers and are roughly at the level of your palm. So metacarpals is to act as the bridge between the wrist and fingers, forming the framework of the hand. Then number 3 is the phalanges. So the phalanges is the bone of the fingers and of the toes. The phalanges allow us to grip and hold onto object. So here's the questions to be answered. So number 1 is, with what bone do the carpals articulate proximally? So the scaphoid bone is the largest carpal bone of the proximal row. It articulates proximally to the radius and distally with the trapezium and trapezoid. So the next we're going to label is the typical cervical, thoracic, and lumbar vertebrae. So in cervical, the number 1 is spinous process. So spinous process is a bony projection of posterior of each vertebra. So the function of the spinous process is to allow for muscles and ligament attachments. So the number 2 is the lamina. So the lamina is the roof of the spinal canal that provides support and protection for the backside of the spinal cord. So the number 3 is the vertebral foramen. So the vertebral foramen is the opening in the vertebra that is formed by a neural arch and back portion of the vertebral body and through which the spinal cord passes. So the vertebral foramen is provide for the passage of the spinal cord and the meninges. So the number 4 is the transverse foramen. So the transverse foramen is a foramen in each transverse process of a cervical vertebra through which the vertebral artery and vertebral vein pass, in which cervical vertebra is expect the 7. So the foramina present in the transverse process of the cervical vertebra give passage to the vertebral artery, an important artery supplying the brain and spinal cord. So number 5 is body. So the body is the thick oval segment of bone forming the front of the vertebra and also known as centrum. So the body bears about 80% of the loads while standing and provides an attachment for the disc between the vertebrae. The front or interior section of the vertebral body protect the spinal cord and the nerve roots. So in thoracic. So number 6 is spinous process. Number 7 is lamina. Number 8 is transverse process. Number 9 is vertebral foramen. And number 10 is body. So this is same on what I've said in the cervical. So in lumbar. So number 11 is spinous process. Number 12 is lamina. Number 13 is transverse process. Number 14 is pedicle. So each vertebra has two cylindrical shaped projections of hard bone that stick out from the back part of the vertebral body. So pedicle providing side protection for the spinal cord and nerves. The pedicles also serve as a bridge joining the front and back part of the vertebra. Then number 15 is the body. So the spinous process, lamina, transverse process, and body is same on what I've said in the cervical. So the questions are number 1, how many of each vertebrae type are in the body and what are the distinctive feature of each type? So humans have 7 cervical, 12 thoracic, and 5 lumbar. So the cervical vertebrae have three main features which distinguish them from other vertebrae. So the number 1 is the triangular vertebral foramen. The number 2 is bifid spinous process. So the bifid spinous process, this is where the spinous process is split into two distally. Then the transverse foramina. So the transverse foramina is the hole in the transverse process. They give passage to the vertebral artery, vein, and sympathetic nerves. So the thoracic vertebra have 4 features which distinguish them from other vertebrae. So here's the number 1. The vertebral body is heart-shaped. And the second is presence of demen facet on the side of each vertebral body. These articulate with the heads of the ribs. Number 3, presence of costal facets on the transverse process. So these articulate with the tubercles of the ribs. They are present on T1 and T10 only. So the number 4 is the spinous process. So spinous process are long and slant inferiorly. This offers increased protection to the spinal cord, preventing an object such as a knife entering the spinal canal. So the last is the lumbar vertebrae. So it is distinctive to other because the lumbar vertebrae carry the largest amount of body weight and are thus characterized by the large size and think of the vertebral body. They have also short transverse process and short blunt spinous process that projects posteriorly. So the number two question is describe sacrum. So the sacrum is a large bone located at the terminal part of the vertebral canal where it forms the posterior aspect of the pelvis. So the sacrum is remarkably thin, which aids in supporting and transmitting the weight of the body. So sacrum is important because it is form a link between the spine and the iliac bone and also as an important part in hip stability.
Left innominate. Number one is the iliac crest. Is the largest of the three bones that make up the pelvis. Interior gluteal line is the middle curved gluteal line on the hip bone. Acetabulum is the socket of the ball and socket hip joint. Ischem is paired bone of the pelvis that forms the lower and back part of the hip bone. Obturator foramen is the large opening created by the ischem and pubis bones of the pelvis through which nerves and blood vessels pass. What bones make up the pelvic girdle? Made of two innominate bones sacrum. What markings on the innominate identify as the belonging to the right or left side? The left and right hip bones, innominate bones, and pelvic bones are two irregular shaped bones that form part of the pelvic girdle. The bony structure that attaches the axial skeleton to the lower limbs. How does the bony structure of a male pelvis differ from that of a female? The general structure of the female pelvis is thinner and less toned as a comparison to the thick and heavy male pelvis, which is designed to support a heavier body build. Left femur. Number one is lesser trochanter, is a conical eminence which varies in size in different species. Number two, shaft. Number three, lateral and medial condyle, is a form the proximal part of the body of femur. Number four, head. Number five, neck. Number six is a greater trochanter, and the last one is patellar surface. In what region of the body is the femur located? It is located at the upper bone of the leg or hind leg. What markings on the femur identify as the right or left side? You cannot feel it on the anterior. So if you take your finger down the shaft of the bone and you feel the line aspera, you have the posterior side of the femur. The femur articulates distally with the head of the femur articulates with the acetabulum in the pelvic bone, forming the hip joint, while the distal part of the femur articulates with the tibia and patella, forming the knee joint. Left tibia and fibula. Number one is tibial tuberosity. Number two is fibula. Number three is tibia. Number four is medial malleolus. And five is lateral malleolus. Where are these two bones located? Tibia. It is the larger of the two and it's not on the medial aspect. Fibula is a slender bone on the lateral aspect of the leg. Which one is lateral? The fibula. Name the bone with the articulate distally. Distal tibia. Left ankle and foot. Number one is calcaneus. Number two is tarsals. Number three talus. Number four metatarsal. And five is phalanges.
So the next to be labeled is the skull lateral view. The number one is frontal bone. The frontal bone is a shell-shaped, unpaired, flat bone of the skull located in the forehead region. The frontal bone consists of six main parts, which is the squamous part, nasal part, two orbital plates, and two zygomatic plates. The primary function of the frontal bone are to protect the brain and support the structures of the head, such as the nasal passages and eyes. Number two is parietal bone. So the parietal bones are bilateral skull bone that form the superior and lateral walls of the cranium. Parietal bone protects the underlying fragile bone. So parietal bone is located on each side of the skull just behind the frontal bone. Number three is occipital bone. So the occipital bone is the most posterior cranial bone and the main bone of the occiput. It is considered a flat bone like all other cranial bones, meaning that its primary function is either for protection or to provide a broad surface for muscle attachment. So the number four is sphenoid bone. So the sphenoid is just one of the 22 bones that form the skull and essentially help to connect the neurocranium to the facial skeleton. So number five is nasal bone. The nasal bones are two small symmetrical oblong bones, each having two surfaces and four borders. The function of each nasal bone is to bind together the cartilage that forms individual nose contours and shapes. The number six is lacrimal fossa. So the lacrimal fossa is located on the inferior surface of each orbital plate of the frontal bone. It is smooth and concave and present laterally underneath the zygomatic process, a shallow depression for the lacrimal gland. Number seven is temporal bone. The temporal bones are two major bones in the skull or cranium. They help form the sides and base of the skull, where they protect the temporal lobe of the brain and surround the ear canal. Number eight is zygomatic bone. So the zygomatic bone is a paired irregular bone that defines the anterior and lateral portions of the face. So, zygomatic bones are important contributors to mastication or chewing, providing an attachment point for the masseter muscles, a jaw adductor that closes the jaw. Number 9 is mastoid process. So, the mastoid process is a smooth conical projection of bone located at the base of the mastoid area of the temporal bone. The mastoid process main function is to provide an area of attachment to several important muscles in the head. Number 10 is maxilla. So the maxilla is the bone that forms your upper jaw and also a crucial bone in the skull structure and enables many basic functions such as chewing and smiling. And last, the mandible. The mandible is the largest bone in the human skull. It holds the lower teeth and it assists the mastication and form of the lower jawline. So the next to be labeled is the skull frontal view. So number 12 is frontal bone. Number 13 is temporal bone. Number 14 is nasal bone. Number 15 is lacrimal bone. Number 16 is zoomatic bone. Number 17 is perpendicular plate of the ethmoid bone. So, perpendicular plate of the ethmoid bone is a flattened bony lamina of the ethmoid bone that is the largest bony part assisting in forming the nasal septum. Number 18 is inferior nasal concha. So, the inferior nasal concha is a scroll-shaped paired bone that rests at the lateral wall of the nasal cavity. It helps to filter and humidify the air that we breathe. The nasal concha are also sometimes called turbinates. Number 19 is vomer bone. The vomer is a small, thin, plow-shaped midline bone that occupies and divides the nasal cavity. So the vomer's main job is to help the structure of the nasal passages and face. Number 20 is maxilla and number 21 is mandible. So the frontal bone, temporal bone, nasal bone, lacrimal bone, zygomatic bone, maxilla, and mandible are same on what I've said in the skull lateral view. So next is the base skull external view. Number 1 is maxilla. Number 2 is zygomatic bone. Number 3 is palatine bone. So the palatine bone serves as a structural function with its shape helping carve out important structures within the head and defining the lower wall of the inside of cranium. Number 4 is vomer. Number 5 is temporal bone. So, number 6 is occipital condyle. So, occipital condyle is an oval-shaped osseous structure located at the base of the occipital bone. It allows the head to move from side to side, up and down, as well as to rotate. So, number 7 is foramen magnum. So, foramen magnum is the largest foramen of the skull and is part of the occipital bone. So, foramen magnum, it is a passage of the central nervous system through the skull, connecting the brain and the spinal cord. So, number 8 is occipital bone. So, the maxilla, somatic bone, vomer, temporal bone, and occipital bone are same on what I've said in the skull lateral view. So this is the end of my part. So thank you for listening.
So for the continuation, we have the base of the skull internal view. Number 9 is the frontal lobe. The frontal lobe is the most anterior or the front part of the brain. It extends from the area behind the forehead back to the precentral gyrus. As a whole, the frontal lobe is responsible for higher cognitive functions such as memory, emotions, impulse control, problem solving, social interaction, and motor function. Number 10 is the crista galli or the rooster's comb or crest. It is a small upward bony projection located at the midline. It functions as an anterior attachment point for one of the covering layers of the brain. Number 11 is the cribriform plate. The cribriform plate is perforated by olfactory foramina, which allow for the passage of the olfactory nerves to the roof of the nasal cavity. This conveys information from the smell receptors to the brain. Number 12 is the lesser wing of the sphenoid. Their lower borders help make up part of the orbits, which is the house of the eyes. while the upper surface makes up a portion of the cranial cavity which houses part of the brain. Number 13 is the sphenoid bone or the greater wing. Sphenoid bone has many essential functions. One of these is it helps form the base and lateral sides of the skull in combination with the orbital floor. It many articulations with other bones that give the skull rigidity. It is an attachment site for many of the muscles and the mastification. Number 14 is the hypophyseal fossa of cilia turcica. The gland is lined by dura mater and lies within the hypophyseal fossa. The cilia turcica, a bony convection in the upper surface of the sphenoid bone. The cilia turcica protects the lower, anterior, and the posterior pituitary margins. And the thin bony plate separates the pituitary from the sphenoid sinus. Number 15 is the petrous portion or the petrous ridge. It transmits the facial and acoustic nerves and the internal auditory branch of the basilar artery. The lateral end of the canal is closed by a vertical plate, which is divided by a horizontal crest, the falciform crest, into two unequal portions rather. Number 16 is the foramen magnum. The foramen magnum is a Latin word for great hole. It is a large, oval-shaped opening in the occipital bone of the skull. It is one of the several oval or circular openings, also known as foramina, in the base of the skull. The spinal cord is an extension of the medulla oblongata that passes through the foramen magnum as it exits the cranial cavity. For the last part, we have number 17, occipital bone. The occipital bone is the most posterior cranial bone and the main bone of the occiput. It is considered a flat bone, like all other cranial bones, meaning that its primary function is either for protection or to provide a broad surface for muscle attachment. The possible roles of the sinuses may include reducing the weight of the skull, dampening pressure, humidifying and warming inspired air, absorbing heat and insulating the brain, aiding in sound resonance, providing mechanical rigidity, and increasing the olfactory surface area. In here, we have muscles anterior view and muscles posterior view. Let us first tackle the anterior view of the muscles. For the number one, we have the sternocleidomastoid. The sternocleidomastoids are superficially located neck muscles that play an important role in tilting our head and turning our head, as well as other movements. The sternocleidomastoids on each side of our body course from the breastbone and collarbone in the upper part of the chest to the back of the head. The the sternocleidomastoid muscle has a cylindrical strap-like shape that emerges from the side of our neck and tapers at the ends. Number 2 is the pectoralis major. The pectoralis major is the superior most and largest muscle of the anterior chest wall. It is a thick, fan-shaped muscle that lies underneath the breast tissue and forms the anterior wall of the axilla. The pectoralis major is the most superficial muscle in the pectoral region. Number 3 is the bicep brachii. The main functions of the biceps are the flexion and the supination, or the outward rotation of the forearm. This is facilitated in part by the 90-degree rotation of the muscle as it connects to the radius. Contrary to popular belief, the biceps is not the most powerful flexor of the forearm. Number 4 is the rectus abdominis, or informally known as the abs muscle. It is a long muscle of the anterior abdominal wall. In those with low body fat, it is clearly visible beneath the skin forming the six-pack. It extends from the rib cage all the way to the pubic bone. Number 5, external abdominal oblique. It is the largest and the most superficial of the lateral abdominal muscle. It lies beneath the thoracic and the abdominal skin, covering the internal abdominal oblique and anterior halves of the ribs and intercostal muscles. Its muscular part contributes to the lateral part of the abdominal wall. Number 6 is the adductor longus. The adductor longus is a large, fan-shaped muscle located in the medial aspect of the thigh. It belongs to the adductors of the thigh together with the adductors brevis, adductor magnus, pectineus, and the gracilis muscles. Adductor longus is the innervated by the anterior division of the obturator nerve. For number 7, we have rectus femoris. The rectus femoris is located superficially on the middle of the anterior thigh extending between ilium and the patella. It is a central muscle of the quadriceps femoris extensor muscles group and acts to extend the leg at the knee. Number 8 is the anterior tibialis. It is a muscle in human that originates along the upper two-thirds of the lateral or the outside surface of the tibia and inserts into the medial cuneiform and first metatarsal bones of the foot. It acts to the dorsiflex and invert the foot. This muscle is mostly located near the shin. Number 9 is trapezius. It is responsible for posture and movement. It allows you to tilt your head up and down and turn your head all around. It also helps you to stand up straight, twist your torso, and shrug your shoulders or pull them back. The trapezius controls your scapula or the shoulder blade when you lift your arm or throw a ball. Number 10 is deltoid. Your deltoid muscles are in your shoulder, which is the ball and socket joint that connects your arm and to the trunk of your body. Deltoid muscles help you to move your arms in different directions. They also protect and stabilize your shoulder joint. Like most other muscles in your body, the deltoids are skeletal muscles. Number 11 is the tricep brachii. It is a large, thick muscle on the dorsal part of the upper arm. It is often appears as the shape of the horseshoe on the posterior aspect of the arm. The main function of the triceps is the extension of the elbow and joints. Number 12, latissimus dorsi. It works collaboratively with the teres major and pectoralis major to perform actions of the upper extremity. Together, these muscles will work to adduct, medially rotate, and extend the arm at the glenohumeral joint. Number 13, gluteus maximus. It is the most superficial gluteal muscle that forms the prominence of the gluteal region, along with the gluteus medius, gluteus minimus, and tensor fasciae latae. It belongs to the gluteal group of the hip muscles. Gluteus maximus extends from the pelvis to the gluteal tuberosity of femur. Number 14 is the bicep femoris. It is a muscle of the posterior compartment of the thigh and lies in the posterolateral aspect. It arises proximally by two heads, termed the long head or the superficial and the short head, which is the deep. It is part of the hamstrings. For the last one, we have number 15, gastrocnemius, where it produces flexion of the leg at the knee joint and the plantar flexion of the foot at the talocrural joint, also known as ankle mortise. Furthermore, the gastrocnemius is most effective when the knee is in an extended position and the ankle is plantar flexed. For the next part of the activity, we have the muscles to be discussed by Miss Kapinpin.